From Lagos, the nation's commercial capital, this is the news at 10, live from Channels Television. Reported tonight,
Bimbo Oloede.
Hello and welcome. Tonight, fear grips the medical profession as federal government insists on continuing its verification exercise for resident doctors. Maiduguri, Borno State capital, under threat as Boko Haram overrun Bama town. APC leadership urges President Goodluck Jonathan to hand over alleged sponsors of Boko Haram to the International Criminal Court, ICC. And an Islamic State video shows the beheading of United States journalist Stephen Sotloff by Syrian militants.
On business news tonight, the organized private sector raises concerns about the effects of unstable power supply on industries.
And on sports news tonight, FIFA keeps Nigerians in suspense as football lovers wait for the governing body's decision after Chris Giwa refuses to step down as NFF president.
Nothing short of a standard and qualitative system of medical practice that would enhance the resident doctors' training can get the approval of the federal government. The Minister of Health, Professor Onyebuchi Chukwu, told a meeting of health professionals in Abuja today that a critical appraisal of resident doctors' training is ongoing and everything possible would be done to improve medical practice. Our correspondent, Lanre Lasisi, reports.
Weeks has witnessed a lot happening in the country's medical sector, from the prolonged strike by medical doctors to the suspension of the residency training program in the country.
Even though the suspension has been lifted, government says there is a great need to appraise the program to tackle some of the challenges observed in the program. These health management officials are gathered to help government come up with key recommendations on the issue.
The government is determined to make the residency program better in terms of being more focused, more productive, and ensuring that each graduate from the program is equipped with the knowledge, skills, and attitude that the accrediting authorities insisted at the onset.
Now, some of the officials say the appraisal will help greatly in addressing present challenges facing the residency training program.
This is a sort of a workshop where all the CMDAs are represented, where the other people in the Ministry of Health are represented, and also those of us who are political heads of these institutions. We want to see across board what is really happening and what can we do about it. And whatever we come up here now will be part of the input to the decision that will be taken by the Federal Ministry of Health and the government generally.
Most people look at residents as if they are workers, but actually they're actually in training. So it's a very good program to assess the residency program in our various teaching hospitals in terms of funding, in terms of cost, content, in terms of quality of the kind of doctors, because these doctors are going to be consultants one day and they're going to treat our persons. So I think it's a welcome development.
The officials are optimistic the resident doctors will welcome this effort to improve the training program.
I think they'll be very glad about this because I've had interactions with some residents and they're of the opinion that the program needs to be overhauled in terms of teaching, in terms of postings, overseas postings, in terms of funding by the government.
Some of the participants at this event say this appraisal should extend to other arms of the sector to ensure the needed transformation in the country's health sector. Lanre Lasisi, Channels Television News.
Health workers in the country are seeking protection and better incentives for their colleagues treating patients with Ebola virus disease. According to the president of the Health Workers Union, Mr. Ayuba Waba, healthcare providers have been the worst affected by the outbreak in West Africa. The union calls for the recruitment of more health workers and better laws that will guarantee the welfare of these caregivers at the front line of fighting the scourge.
This forum is organized by the National Union of Medical and Health Workers in Nigeria to provide training on how to manage Ebola cases without being infected with the virus. Conveners say medical health workers are mostly at risk of contracting the virus. Statistics reveal that since the recent outbreak, over 200 health workers have contracted the virus in West Africa. In Nigeria, out of the 6 deaths recorded, 3 were healthcare workers. Apart from this workshop, members believe there is a need for insurance and better legislature, just as the National Association of Nigerian Nurses and Midwives threaten industrial action. Because of discrimination and poor welfare.
There should be sufficient, incentives, to make people take go out there and take the risk, to actually provide the services. We think that government should provide, really robust insurance.
We call on therefore the Senate to do everything possible, having taken on board the concern of all relevant health professionals to make sure that this bill sees the light of the day and is passed into law before the end of September.
They know that in collective bargaining, the best thing to do is to prevent industrial crisis. We have just come out of one. We are not praying for any, and that is why we are optimistic. But in event that this our optimism is shattered, if painfully we cannot resolve to what we are looking for, the National Executive Council of the Association will meet and decide the appropriate action to be taken.
Meanwhile, the National Council on Health on Monday passed a resolution to press for life insurance coverage for health workers handling Ebola cases.
The Council also reiterated that the provision of adequate incentives, including special allowances and life insurance policies, must continue for all health workers involved in the management of Ebola virus disease in Nigeria.
While all health workers are at the risk of contracting the virus, experts believe that those working in laboratories, nurses, laundry and clinical services are at greater risk.
If the late diplomat had reported to the appropriate authorities, Rivers State would not be contributing to the burden of Ebola virus disease in the nation. That's according to the governor of the state, Chibuike Amechi, who also says he has the situation in hand. Other concerned parties have also been contributing to the enlightenment and containment of the disease. Our correspondent, Mary Alali Yusuf, reports.
The governor of Rivers State, Chibuike Amechi, has been speaking about how a conspiracy of denial of the Ebola disease and a cover-up resulted in a chain of contacts starting from the diplomat who ran away and slipped unnoticed into Rivers State.
An Ebola patient.
He also explains that the state has been thrown into a needless emergency by these heedless actions, but promises that the situation is under control.
His wife, who is a medical doctor, who is here in Lagos, did not tell anybody. Then the so-called diplomat, the Olu Ibuku Koye, did not tell. In fact, he denied when he was confronted. He denied. So he had a situation where nobody knew. Then the doctor, having gotten money from the Olu Ibuku Koye, held a child naming ceremony. Wow. And invited people. When the doctor died, the wife is a medical doctor. The wife knew the dangers of Ebola. She allowed people to come from Anambra and other places to pay her condolence.
Abia State has not recorded any case of the virulent Ebola disease, but is a close neighbor which shares a border with Rivers State. Consequently, activities have been on to make the indigenes ready to tackle the disease. The State Commissioner for Information speaks of preparations so far.
We are proactively equipped, procured all the necessary PPEs, what we call personal protection equipment for healthcare practitioners. We have also brought in facilities that will, in a proactive manner, prepare us.
There are reports that the 19-year-old student of the Faculty of Law in Ahmadu Bello University is exhibiting symptoms similar to those of the Ebola virus disease. Authorities there say his blood sample has been sent to Lagos for testing and results should be out on Wednesday.
Hello. I want to take a few moments to speak directly to you, the people of West Africa.
The President of the United States, Barack Obama, is pledging his support and that of his nation for countries that have been ravaged with the dreaded Ebola virus disease. Here, he shares some tips and facts about the scourge.
The most common way you can get Ebola is by touching the body fluids of someone who's sick or has died from it, like their sweat, saliva, or blood, or through a contaminated item, like a needle. That's why the disease is continuing to spread where patients are being cared for at home or during burials when families and friends lay their loved ones to rest. That's why healthcare workers wear protection like gloves and masks. It's why if you feel sick with a high fever, you should get help right away. Because with prompt treatment in a medical center, nearly half of patients can recover. And it's why when burying someone who has died from this terrible disease, it's important to not directly touch their body.
The U.S. President equally adds that it is possible to honor the dead or loved ones without putting the lives of the living in harm's way, and to improve public health so that the scourge does not recur. Delay and denial are two things that could cost us a great deal during this trying time. But experts assure us that if suspected cases are promptly reported and those under watch remain in places designated for them, more lives will be saved. Mary Alale Yusuf, Channels Television.
In part two, after the break, APC leader Bola Tinubu replies Chief Tom Ikimi's defection letter, describes him as unreliable and unsuitable for the position of party chairman. Do stay with us.